Now I know, too, you've been working with a therapist, which is an important part of this because I'm sure you're scared to just even be at home alone sometimes. But I know your therapist talked to you a little bit about the scars. Can you tell us about that?
Yes, so I've been seeing a therapist. I went to see Dr. Sharon, and he said that it might be a good idea to try and work on removing or fixing some of the scars, and that might be helpful. And, you know, I've thought about it before, but I didn't have the finances or the ability to go do that. You know, it's not something that's covered by insurance or that you can really, you know, just go do.
Sure.
And so he gave me some hope, and he told me, hey, there's a doctor that I know that might be willing to help you.
Wow.
And so he did.
Well, and I think that Holly's story,
me.
we're really trying to highlight every element of this story, the physical, the emotional, where those two intersect. Holly did enlist the help of a board-certified plastic surgeon, Dr. Shankar Lakshman, for scar treatment. All the work he has done for Holly has been offered free of charge. We actually joined, and we were there the day they were scheduled to be removed or lessened.
Today we're going to remove scar keloids from Holly's chest and torso. The purpose is to remove the pain, and we'll be doing that under local anesthesia.
I'm having surgery to relieve the pain and the issues that I'm having as a result. I'm just really happy that this is going to be the last of a very long and difficult road.
Prior to the excision, I inject each of the keloids with a mixture of Kenalog and lidocaine, and that's to help flatten out the keloids.
That one really hurts.
So we're going to go ahead and do this in sections. Do the chest first, and then we'll go and work on you on the side. Is it painful when I touch in there? Does that hurt?
Yes, that hurts. I can feel the sharp pain.
Holly is still having a lot of pain here, and I don't think it would be wise for us to proceed under local anesthetic with this procedure.
I'm here today and able to do it going under anesthesia.
This has now been 1 week since we tried to remove Holly's keloids. I think some of that may be due to the scar tissue, or she was just having too much anxiety. We're removing the scar tissue. You can see it spreads apart when we remove it. It makes it challenging. What prevents them from growing back is to make sure there's no tension at the skin line. I'm going to close this one first. If I remove this skin, it may try to pull this one apart. Last couple of stitches for this one. The first one is finished. Now I'm going to begin the side area. There are 5 keloid scars on the side here, and I believe that we can remove all of them and close them so that it heals in a much better fashion. And now that my final keloid is removed, I'm going to complete the closure. We've completed the procedure, and we've excised 6 of the 7 keloids.
Dr. Lakshman actually joins us, and of course, we saw that, but what all is involved in trying to remove some of these scars?
Well, typically the scars are injected preoperatively. We use a mixture of Kenalog and lidocaine, as I mentioned in the video, and it's in order to prepare the scar for the excision. It helps to shrink the scar tissue, and when the scars are removed and closed, then it prevents the scars from recurring. Sometimes patients need to have additional injections after the scars are removed, and that's to prevent them from recurring. The keloids can behave kind of like tumors in that even months to years later they can come back. So we may not be done with Holly. And I also just wanted to mention just how incredibly brave Holly was for the injections. These are really painful, and it's just sort of a testament to her will, the survival will you were talking about earlier.